Witness the contrast. There we are, sitting at the desk with the keyboard. Now these are just some positions that some people favor. It is said that sitting at the desk, you should have a 90, 90, 90. For a lot of people, it's not comfortable. If you increase your 90, as long as your chair is safe and does not slide, that's okay. This increase of 90 is not good. Because as you see, that's one of those tall fellas with his knees up in the air. Reaching and stretching. She's trying to paint. Why not put a cane on, use a roller instead of stretching? Instead of bending over, which is not good, especially if you have to do it time and time again. Lifting and carrying. None of them good because we're out of our safety zone. Those boxes are out of the safety zone and then became 10 times heavier, including the bad positions that they're using. When you're bending to pick up anything, that is the position and the posture that should be used. Don't forget, our back has all those curves which we should maintain whether we're bending down, picking up, standing, sleeping, whatever. So we bend our hips and our knees. The strongest muscle in our body is these here. And that's what you should use when you're picking up. So you're bending, picking up, or you bend one in front of the other, picking up and reaching up. When you're doing this, you're using these muscles, which are the weakest, and you get up and you get that slip disc, you get muscle spasms, you get strains and sprains and all of those kind of things. Exercises, my favorite subject. Repeated strain can cause wrists and hands to become tense. Tension can lead to stiffness and soreness. So, moving around in your chair can help release tension. Stretch and relax your body whenever you have a free moment. And these are some exercises I've put in for people who are working at the desk. Those of us who use our fingers, we need to stretch them and move them. Those of us with our necks, we need to turn them, but a nice, gentle movement. Not a sudden one, but a nice, gentle turn. And whatever you do on one side, you've got to do on the other side. We need to stretch the head down, stretching those muscles so we release a lot of that tension in here. Bending head up, shrugging our shoulders, stretching our hands. This prevents a lot of carpal tunnel, this particular movement, up and down. And of course, we need to keep our legs strong. Getting to the end. The economic impact of work-related injuries is significant. Health ergonomic risk analyses can improve job performance by providing the framework for a safe and productive environment. A health ergonomics program reduces the fatigue and injury associated with work demands. And of course, the rehab department of Doctors Hospital can provide job task analyses and functional capacity evaluations for employees who are interested. And I will explain those two. Functional capacity evaluations are The purpose of a functional capacity evaluation is to provide an objective measure of a patient's or client's safe functional ability compared to the physical demands of work. Why we perform a functional capacity evaluation is a lot of people who are injured on the job go back to work and are again repeatedly injured. So you're injured on your job, you go back to work, you get injured again, you get back off the work, you go back again. You have your rehab, you have your exercises, and you have your everything, but the job that you are performing needs to be evaluated in how you perform it. That is what is a functional capacity evaluation. And it includes a comparison of work-specific capabilities which are not addressed with standard skill therapy like physiotherapy and occupational therapy. And it evaluates and assesses safe maximal testing limits and safe repeated limits. We look at you while you're working for your 8 hours and see what you do. We time sometimes what you do, we measure what you do, we look at what you do, how you lift, how you push, how you move around, how you do a job. We do those things. And the job task analysis is a comparative structured process that identifies and quantifies the physical components of a job. By that, it looks at the tools and the equipment that you use, taking all appropriate worksite measurements, and identifies appropriate modifications. We are not the same. The tools are the same, but we are not the same. We have to sometimes modify what we do, and you need to be taught after repeated injuries how to modify what you do to prevent injuries on the job. That is why a job task analysis can be done. It also involves a basic overview of the job, because we have to look at the job that you are doing. We have to look at the duties and responsibilities that are involved, as well as the education that you received to do the job and the experience that you have at that job. Thank you, everybody.
You've been watching Doctors Hospital Distinguished Lecture Series, presented every third Thursday in the month. Thank you for joining us.